radiology department and the medical director of neuroradiology and MRI.
And when it comes to neuroradiology, can you very briefly just say what that entails for the average health consumer out there?
Yes, neuroradiology is imaging of the central nervous system, so mainly the brain, the spine, and the head and neck. Usually we use things such as CAT scans and MRIs as well as X-rays.
Okay. And I assume you're there and you take calls, remote calls from other facilities within the system when someone comes in with a potential neuro emergency.
That is correct. We have what's called a spoken hub model of stroke care. So Baptist Hospital Maine and Miami Neuroscience Institute is the hub where we're a comprehensive stroke center and the advanced thrombectomy treatment takes place. The other facilities are either primary stroke centers or stroke-ready centers in the system, and those are the spokes. And we try to coordinate care between those spokes and the hub so that we get patients in time to avoid any neurologic deficit or mitigate any neurologic deficit.
Okay. Now, walk me through, I guess, that day when you received the alert or call regarding Ms. McClure, if you can.
Yeah, so this was an interesting case because I actually didn't receive a call on this because she didn't present to the Spoke Hospital as a stroke protocol patient because apparently her symptoms were very mild and they had been present since the previous day. So I don't think anybody, including the patient or anybody examining her, was thinking, oh, this person may have an acute stroke. I think she was just complaining of some numbness on one side of her body. She didn't have any speech difficulties or weakness. So in a 20-year-old person, the first thing you're thinking of is certainly not going to be stroke in that instance. So her CAT scan came onto my list in a stat list, that meaning, read this case as soon as possible or right away. And I opened up the CAT scan, and that's when I saw the abnormality.
Okay. Can you explain this abnormality? And I understand it was an MCA, if I'm not mistaken. But please tell me about
what she had was a non-contrast brain CT, and on the brain CT, what I saw was what we call hyperdense, meaning it was whiter on the CAT scan than other structures, or whiter than it should have been, in a large branch that feeds the brain known as the left middle cerebral artery. And when it's hyperdense like that, it's usually related to acute clot. So something was blocking off the blood. There was a clot blocking off the blood flow to the left middle cerebral artery. The other thing I saw, she was starting to have very, very subtle and early changes of an acute infarct in the brain substance, the brain parenchyma, if you will, in that region, but it was very minor. We usually grade the CAT scans based on what's called an aspect score. The higher the score, the better the brain looks. She was pretty near a 10. She was probably about a 9. So there was still plenty of brain to save there, and we had to act very quickly.
Okay, so and obviously this is very urgent because,
Yes. Yes, so at this point, yes, the first thing I did was I picked up the phone and I called the emergency department physician, and I said, this patient has a left MCA clot. She has early changes of an acute ischemic infarct, and I said she needs to be transferred over to Baptist Hospital as soon as possible. I even said as of yesterday type thing. But that wasn't enough from my perspective. I saw it was a 20-year-old girl, and I was told she didn't have many symptoms, and the symptoms were from yesterday. And I said, I'm concerned that she could fall through the cracks, because if somebody examines her and they say she doesn't look as bad as, the CAT scan, I'm not sure that she may get transferred. And I didn't want to leave it to chance. So the next thing I did was I called the stroke neurointerventionalist, Dr. Linfante, and he was actually doing a stroke case that we had read earlier. So he was scrubbed but somebody answered the phone for him and put me through to Jesseline Pozo, our best stroke nurse. And I told her what was going on, and I said, please call the transfer center and do everything you can to expedite this patient.
Okay. So the Infante was was on call or on alert for the arrival of Ms. McCoy.
Correct. Well, he was already doing a stroke case from earlier that day, so he was scrubbed in on a case, so I couldn't even speak to him directly, which he did call me back maybe a couple of minutes after I spoke to Jesse on the case, because he had just finished treating that other stroke patient.
Now, I've written before about ischemic strokes and such, and the symptoms are usually more pronounced than what you're telling me. So is this, if you said early phase ischemic attack, if that's the right wording, I don't know, is that unusual?
It's sometimes unusual, specifically when it's involving the right cerebral hemisphere. It's less unusual because most people, over 99% of the general population, are left hemisphere dominant for speech, particularly if you're right-handed. If you're left-handed, most people are still left hemisphere dominant for speech. But there is a significant minority of patients that are left-handed that may be right hemisphere dominant for speech. So when I heard how mild her symptoms were, I was wondering, was she left-handed? And if she was left-handed, she may not show as severe symptoms as somebody that was left hemisphere dominant for speech.
Did you find out later if she was? Or?
I did find out later. They said when she was signed the consent form, she signed with her left hand.
Well, okay. All right, so continue now the progress. She is taken to Baptist.
Correct. So at this point, since we already knew that she had a clot in the blood vessel, sometimes we will do what's known as advanced imaging. We'll do a CT angiogram, inject intravenous contrast to see exactly where the clot is and what is going on. However, at this point, since we know where the clot is already, because it happens to be white on CAT scan, it isn't always, and sometimes we do the CT angiogram, Dr. Infante and his team felt it was best to bypass additional imaging and just go right ahead to do the angiogram to extract the clot as soon as possible to reperfuse the brain.
Okay. And she underwent, is it a thrombectomy, am I correct? Or
yes, it is.
Could you call it a mechanical thrombectomy, or are we talking?
Yes, that's exactly what it's called. Dr. Infante would give you a better idea of this, but they usually go through the groin, and they go in with a catheter, and they bring the catheter up to where the clot is, and there's usually two different types of devices that they use to take out the clot. One looks like a stent, and it wraps around the clot, and they pull it out, and the other is kind of a suction device where it sucks on the clot, and they can pull it out a little bit like a vacuum.
Okay. And she underwent the procedure, and no problem. She successfully,
Yes, he was wonderful about doing this. He then sent me a screenshot of the large clot he extracted from her left middle cerebral artery, and he said that she was doing great, and I couldn't have been happier. It really made my day. She's 20 years old, and I have two children that are about that age and also in college, so it really hit home for me as well.
Yeah, I have two sons who are a little older, but that's remarkable. By the way, did you speak to her or see her before the thrombectomy? Or
no, I didn't. The only time I actually saw her was a few days after she had the thrombectomy. I spoke to Jessie, our best team nurse, and I said I'd really like to meet her. As radiologists, we frequently do not get to see the patients that we make diagnoses on, and I just felt it was very important for me to see her, just to talk to her and see what her presentation was. And it was very gratifying to meet her. And she and I actually had some interests in common. She's a music major, and I have a very strong affinity for music, although not musically talented like she is. So we got to speak for a bit, and she was telling me a little symptoms that she currently has. And again, I couldn't have been happier.
And she's also studying classical music singing, is what I understand.
Yes.
Did she? You mentioned speech was minimal, impaired during the.
So initially they just said it was numbness, but then I heard later on that she was having some stuttering of her speech. So at some point before the thrombectomy, it was affecting her speech. And this is not uncommon where you have somebody that their CAT scan is very concerning, but the patient's doing well. And it's very difficult to try to convince people to go in and take out a clot when the patient's doing pretty well. The reason they do well is they have what's called collateral flow. They're getting blood flow from other arteries around that blocked artery. But once those collaterals give out, frequently when the patient goes to sleep and their blood pressure goes down, all of a sudden that part of the brain becomes ischemic, and then they can become profoundly symptomatic from the clot. So she was already having some stuttering symptoms with stuttering of speech, apparently not profound, but again, if you wait on this, it's potentially irreversible when it happens, especially when they go to sleep. You're not doing a neurologic exam on them every 10 minutes, so you don't know when that symptom occurs. So I think the best mode of treatment for her was to get that thrombectomy before she became more symptomatic.
And as far as you know, no underlying risk factors such as high blood pressure, or
I'm not aware. Looking at her, I would say there's no way this nice young woman has high blood pressure. She looks fit, trim, and I don't think that would be an underlying abnormality with her. And also at that age would be an unusual reason for stroke. Usually in that age group, what we think of are what's called the dissection, where it's a little tear in the blood vessel and the blood goes underneath it, and that could be caused by minor trauma. She didn't have a dissection. Another etiology could be a persistent foramen ovalia, a small hole in the heart, and they can get what's called paradoxical emboli going to the brain. I don't believe she had that, although I did not see all her diagnostic testing. Then they have to be worked up for other coagulative disorders. And when I saw her, they were still working her up, so I don't know if they have a final idea of what the etiology was. And sometimes we don't even know why somebody had a stroke. They're called embolic stroke of uncertain source. And, so sometimes we don't know, but we just try to modify everything we can.
And I know MCAs can be a result of aneurysms that as in DVTs that can move from elsewhere in the body up through the brain or to the brain. Is that correct? Or
I'm sorry, could you repeat the question?
The middle cerebral artery type stroke like she had, could it be a result of DVT or?
So it's interesting. So usually you wouldn't think of a clot in the vein of the leg going to the brain, but when that can happen is when somebody does have that PFO, a patent foramen ovale, a hole in the heart, because then the clot can go from the leg up to the heart, through that hole in the heart, and let's say when somebody coughs or sneezes or valsalvas and changes the pressure of the heart, that's what they call a paradoxical embolus, where it can actually go to the brain, where a DVT can be the cause of an embolic stroke to the brain. Yes, so you are correct, that can occur.
But we don't know in her case if she has that, probably
correct.
Not, I mean, it's unlikely, but we don't know.
Correct, but that is definitely something that they do, that is part of the workup.
And at this time and place, we have to ask the question, because the last patient testimonial story we did was a perfectly healthy and athletic 57-year-old who had a stroke 30 days after testing positive for COVID. I'm wondering, did she ever test positive for COVID? Do you know?
I know when she first came, she tested negative. I'm not aware if she ever tested positive, but that's a great question, and that's one of the questions we always have with specifically a young patient having a stroke. We've seen several COVID stroke cases now in younger people. However, they usually don't have one isolated clot. Usually they have many clots in different branch vessels and even in the aorta and some of the larger vessels in the neck. And we didn't see that in her, thankfully. So we're hoping this is a non-COVID isolated event that will never happen again.
Right. And in your experience, are you seeing younger? I know there's been a trend. I spoke with Dr. De Los Rios a while back about this, and a trend of younger folks suffering strokes. Maybe an increase among younger folks as opposed to older, over 40 or over 50. Are you seeing that over time?
Well, you know what? It's kind of hard to tell now because when we're detecting strokes more readily on patients, years ago, if somebody had minor symptoms, they wouldn't come into the hospital, especially a young person. You know, everybody thinks they're invincible. They have some mild symptoms. They say, oh, I'm not going to the hospital for this. Now that we've educated the public so well, thankfully, these patients are now coming in with some quote-unquote mild symptoms, and then we do the workup and we see that they've had strokes. So I think that part of it is we're getting patients and we're detecting more of them because they're not ignoring these minor symptoms. And there may be an increased incidence as well. As we know, there is a obesity problem in this country, and that certainly is a risk factor for stroke.
Right, and that's a big, obviously a big contributor, as Dr. De Los Rios mentioned as well. And I know that last year there was a famous young actor in his 40s who had a fatal stroke. I forget his name right now.
Yes, I remember that as well. And it's usually these actors and celebrities that bring these issues to the forefront, and it's we never like to see it happen to anybody, but if anything good could happen from it, it does educate the public.
Great. Anything else that I've missed on her story, her path to?
Well, what I would like to say is that, and I truly believe this, that treating stroke is a team sport, and so we can't just rely on if we think somebody kind of detected the urgency of something. And it would be one thing for me to communicate this person has an acute left MCA clot and early changes of an acute infarct, but I think we need to go the extra distance and say this patient needs to be transferred immediately, because in somebody that doesn't have many symptoms, they may just say, okay, let's just keep the patient and see what happens. So it's not just what we say, but it's really how we say it. And communication in all of medicine is key, and specifically for stroke, because every minute really does matter.
Absolutely. I throw that to my colleagues if they have any questions. Carol or Gabby?
Gabby, did you have anything you wanted to add first?
Dr. Abrams, yes, I just had one more question. When I was speaking to Nina Cruz and Jesse Pozo about this case, one of my first questions was, how did this happen to this girl? She's so young and she's healthy. And they really didn't have an answer for me. I know that they were doing diagnostic testing afterwards to see what was the cause, but they mentioned maybe birth control pills. And I don't know if that's like something that you see more frequently now. They said that there's some type of link between birth control medication and strokes.
Yes, there is. Birth control medications is one of the medications that can make you what they say hypercoagulable. That means propensity to form blood clots, and that would be a risk factor for causing a stroke. And usually, I think on the inserts they list stroke as one of the potential complications of being on a hormonal type of medication such as birth control pills. We sometimes see it more frequently in patients that develop clots in the veins, either in the legs or in the head. Sometimes you can have a stroke actually from clotting in the veins in the head as well. So it can produce a hypercoagulable syndrome in a patient susceptible to same.
Again, I don't know if she was on birth control or if that was confirmed or anything, but that was one of their theories in the beginning. So
Sure.
Thank you. Carol, I don't know if you have any other questions to ask as well.
Yes, on this other subject of kind of messaging people to not delay their care, you're in a particularly appropriate field for that because of stroke. You have to get on it right away.
Absolutely.
So if you would have a message to just anyone about, maybe they're feeling a little bad, but they don't, they might put it off. What would you tell them?
I would say there is very little downside in being checked out in the emergency department to make sure you don't have anything serious going on. By ignoring it, it could have potential life-changing course, not only for yourself, but your family members and others around you. And it's just not worth saying, I'm just going to ignore it. It's much easier. Get yourself checked out and make sure you're not having a stroke, because again, it's not a minor thing, it's your brain. And that's, as a neuroradiologist, I feel it's the most important organ, and it makes us who we are. And if that's the one thing I can really stress is, don't mess around with the brain. If you're questioning sort of like heart attack, you're questioning, am I having a heart attack or is it indigestion? Go to the hospital, get checked out. It's not worth playing with fire.
What would you say? That was great. What would you say about people who might worry about COVID? The risks of getting COVID versus the risk of your life. What would you say there?
I would say the risk of transmission of COVID in the hospital, especially at our facility, is nil. Nothing is zero. However, you're more likely to have a negative event by not coming to the hospital than by coming to the hospital. We had actually a very close family member whose daughters were scared of bringing the mother into the hospital, and she already had COVID. She didn't have it yet. She didn't test positive yet, but she had all the symptoms of it. And the family members did not want to bring her in. They said, if she doesn't have it, maybe she'll get it there. And everybody that goes to the hospital dies. And this is a woman in her 80s. I said, you got to understand, the people that don't make it are the people that say, I'm not going into the hospital. I said, we have treatments for them. She'll definitely need oxygen, and she may qualify for remdesivir or plasma. And thankfully, they listened to me. She came to the hospital. She was treated. She was in the hospital for about 8 days. She went home. Thankfully, she is still fine today. She has had not any complication of the COVID. So anybody that has symptoms of COVID that are severe enough that you're thinking of going to the hospital, such as you're short of breath, you should go to the hospital. We have excellent care for oxygenation, antivirals, other factors, what they call the prone positioning. And if it's somebody with a stroke, we test everybody, we isolate people, we do everything we can to make sure there's no patient-to-patient transmission or healthcare provider to patient transmission. Everybody's wearing masks. It's probably one of the safest places to be is at the hospital.
Okay, thank you very much. That's great. That helped me a lot.
Thank you.
Steve, you good?
I'm good. Yeah, I was just trying to think if there was anything that I wanted redone. The only thing I would say that I would want to redo is, John, what you guys more for writing the story, but for video, I would say if we could get you to redo a little bit of the part about you discovering it as the neuroradiologist, a little bit short of an answer, something along the lines of, as a neuroradiologist, this is, I don't know if this is something rare that you saw or if it was just what the red flag was that said, I need to act now.
We can redo that now if you want. I think I could probably simplify it a bit.
Yeah, let's do that. The first part.
Go ahead.
So I think it was the main question. It was like, what was it that you saw to, make this such a red flag?
Go ahead.
So what was very interesting in this case was normally a stroke protocol patient or a brain attack patient, if you will, they come in, we receive phone calls on that patient because time is brain and we have to stop what we're doing. So normally that comes in, we drop everything we're doing, we get on the phone, we look at the images, we call the neurologist. In this case, the images just came on our list to read, and there was no alerting phone call. So when I opened up the case and I saw this white clot in the left middle cerebral artery, which is one of the main blood vessels feeding the brain, that was a big shock. to me, because normally we're going to get called on that because the patient is going to be very symptomatic and come in with signs and symptoms of stroke. She did not come in with those red flags, if you will, to alert everybody for stroke. She was just a 20-year-old patient with very few symptoms.
All right, yeah, no, that's perfect.
Is that better?
Yeah, no, I like it. I'm like you. I have a 20-year-old daughter myself, and it gives me goosebumps when I hear about. Oh my gosh, it could be the same story. She's away at college, and gives me
I know.
goosebumps.
I when I saw her in her room, I said, you know, where are your parents? I think she's from Texas, and she said, you know, they drove to see her and everything. Because as a parent, I would be like, you know, especially in this environment, trying to get a plane, but I guess things are a little better now. You can fly, but just hearing that your child has had a stroke, or listen, when it's your child, any minor thing happens, let alone something major like a stroke, you worry and you try to be there as soon as possible. So I'm glad that her parents were able to make it and see her, and I think that was comforting to her as well.
Yeah, I believe her.
Yeah, I heard that. I guess when she went into the stroke, she talked to the parents talked to Dr. Linfante over FaceTime to kind of give her a little reassurance. You know, I know for a parent, you know, me being a parent, I would want that's reassuring to me.
Absolutely, and Dr. Linfante is excellent about doing that. He knows how to not only talk to the patients, but patients' family members, to let them know what's going on and what to expect. And I think that can be very reassuring, because when these things are happening, it's certainly not an elective procedure. It's every second counts. And again, it depends how you use your words and how you communicate is how they're going to basically comprehend what is going to be transpiring.
And I think that's any more questions, guys?
No, I'm good. I got between my redo and Carol's questions with the statement. I think I got good footage I can use.
And if we have any questions, the doctor will email you, but I think we're good from your end.
Please.
And we're going to talk to Ms. McClure, I believe, Thursday. Gabby?
Oh, excellent. Send her my best.
Yes.
And again, one important thing, since I don't know which part of the video you'll be using, I think one of the most important things I probably said is it's not just important that we pick up the finding, but how we communicate the finding to everybody.
Absolutely.
And, you know, if I would have just picked up the phone and called and said, this is what's going on, I don't know that this would have happened. You know, I basically alerted the stroke team, you know, before the other hospital even alerted them, or even the transfer center. So it's so important that we become the patient care advocate for that patient. And that's what I tried to do with her. I didn't want to just leave it and say, well, hopefully, you know, she'll get transferred quickly.
Yeah, no. Fortunately for her, she was there at your doctors and part of our system with Miami Neuroscience Institute, and you and your team. They're very fortunate. And you did a great job. Now it's time for us to do our job, which is to get the message out and hopefully maybe, you know, save some lives or help get people to get their health care. So thank you very much, Doctor. We appreciate it tremendously.
Thank you.
Take care.
Thank you all.
Dr. Abrams.
All right, bye.
Take care.
Bye.
Bye-bye.